Do you ever feel like someone else's strong beliefs start affecting how you see the world, even if they're not true? Imagine living with someone who truly believes spies are watching them, and after a while, you start feeling it too, even though there's no proof. That's a real condition called Shared Psychotic Disorder, also known as Folie. It usually happens when two people are very close, like family members or partners, and one person with psychotic thoughts shares them with the other. The healthier person slowly starts believing the delusion too, just because of their deep emotional connection. Have you ever changed your mind just because someone you trust deeply believed something strongly? It's like that, but much more serious and real to the person. So what causes this to happen? Most of the time, it's a mix of isolation, emotional closeness, and one person already having a mental illness, like schizophrenia or a delusional disorder. Picture this: a husband lives with his wife in a remote village. They rarely see others. The husband starts believing their food is being poisoned by neighbors. The wife trusts him completely and sees no one else to ask. Over time, she also begins to believe the food is poisoned. The illness spreads not by germs, but by trust and togetherness. It's more common when one person is dominant and the other is more passive or dependent. Stress, lack of social contact, and living in closed environments make it more likely. So it's not catching like a cold, but more like emotional brainwashing through closeness. What would you notice if someone had this? The main sign is both people sharing the same false belief, a delusion. For example, both might insist they're being followed by government agents, or that someone is trying to steal their thoughts. They both describe the same story, with matching details. They may act on it, like refusing to leave the house or accusing others without proof. The person who originally had the illness usually shows more symptoms, like hearing voices or seeing things that aren't there. The other person might seem mostly normal, except for that one shared belief. Have you ever believed a rumor just because your best friend was convinced? This is like that, but the belief won't go away, even with evidence. They both truly believe it, and neither sees it as strange. Doctors diagnose it by talking to each person, ideally alone. Why alone? Because if they're together, they might just repeat each other. Imagine asking both parts of a couple together, "Do you think aliens control your dreams?" They might both say yes because they've practiced the story. But if you talk to one privately, you might see that one truly believes it, while the other just goes along to keep peace. Treatments usually start with separating the two people, especially if safe. Then, therapy and sometimes medicine, like antipsychotics, help the main person with the illness. The shared person often stops believing the delusion once apart and gets proper support. Family counseling helps them both understand what happened. Think of it like untangling two knotted strings. You need to separate them gently before fixing each one. Can we stop it before it starts? Yes, mostly by staying connected to the world. If someone you love has serious delusions, don't get drawn into isolation with them. Keep talking to others, keep outside routines, and don't be afraid to ask for help. For example, if your sibling says, "Don't answer the door, the postman is a fake," and you find yourself avoiding the door too, that's a red flag. Talk to a doctor. Support groups, mental health checkups, and staying socially active reduce the risk. It's like emotional hygiene, just like washing your hands to avoid germs. Staying mentally connected helps you avoid false beliefs taking over. Recent studies show that shared psychotic disorder is rare, but more common in families or couples with poor social support. New research uses brain scans to see how beliefs spread between close people, almost like emotional mimicry. Some therapists now use virtual reality to help the shared person relearn reality by practicing real-world social scenes safely. Also, telehealth makes it easier for isolated families to speak with doctors early. In one recent case, a mother and daughter both believed their house was haunted. After separation and online therapy, The daughter quickly realized it was stress, not ghosts. Science is now focusing on early detection and strengthening a person's mental immune system,